am Anaya Brooks. I am with Chahuchi Tech. My course number is 1105 and it's September 3rd. Today I'll be talking about asthma and asthma attacks. So asthma is a respiratory disorder that develops early in childhood. According to the CDC, this is a genetic disorder passed down from parent to child. An asthma attack is what happens when the lungs or when the airway becomes smaller and mucus can fill it, and it just causes breathing overall to become more difficult. There are medications for asthma. Two of the main things in form of inhalers are long-term asthma control inhalers and then quick relief inhalers. So long-term inhalers is a daily dose, and it helps lessen the chances of an asthma attack and or makes them less intense for the child. Long-term inhalers do not assist when a child is actively having an asthma attack. That's where quick relief inhalers come into play. So quick relief inhalers is the medication that a child would take when they feel an asthma attack coming on, or if they are actively experiencing an asthma attack. It helps open the airway a little bit more, helps get air to the lungs, and kind of, helps them cool down from this attack. It is important for teachers, parents, and children with asthma to learn the signs and symptoms triggers for asthma attacks. So some signs of a child having an asthma attack involve coughing, wheezing, and tightness in the chest. Some triggers for these can be very wide variety of triggers, but some include weather change, pollution, air pollution, extreme physical activities, stress, allergies, and many more. So it is important for a child to learn their triggers so they can kind of prevent going into an asthma attack, and it's also important for parents and teachers to learn the signs of asthma attacks. It helps when the teacher has a plan. Usually young children who have asthma should go in with a plan to help the teacher just acknowledge their symptoms, because sometimes you don't see right away when they are having an attack. Some children even continue trying to be active during an asthma attack. And because it does affect the breathing, it could be life-threatening. In some severe cases, emergency visits, hospitalization, and even death can be caused by asthma attacks. So it's very important, and when teachers who are dealing with a child who is actively having an asthma attack, it is important for them to be able to stay calm when interacting with the child. Any added stress can heighten the attack and stress out the child more than needed. It's also important for teachers to help administer the medication if the child is too frantic to do it themselves. Normally, an inhaler is about this big, and you shake it to get all the medicine mixed together and stuff, and then pump it once to make sure it's working, and then put it to the mouth, push it, breathe in, and hold it for about 3 seconds or so, and then release. Sometimes you would have to do that twice, sometimes once. And make sure the child is comfortable in a comfortable seating or standing position. Whatever helps make breathing easier for the child, um, and keep them calm, keep them breathing, and try not to add any added stress. As someone who has asthma, have experienced a handful of asthma attacks in my time, and it is very important for teachers to be aware that it can be a very stressful experience for a child, and a child who is experiencing stress, it could cause it to heighten. So just making sure that you are calm and you are acknowledging that this is a real thing, it is very important. There should be policies in schools that help manage asthma, and like I said, some families usually have their own plans and strategies in play, which are important to share with the teacher. But once again, my name is Anaya Brooks. I am with Chattahoochee Tech. My course number is 1105.